Good morning. Today we're going to be talking about the World Skin Day, which took place on Monday, the 8th of July. And with me, we have two dermatologists. Thank you, Dr. Anaba and Dr. Akinkugbe, for coming on the program to talk to us. It's always a pleasure to have you with us.
Thank you for having us.
Thank you, Dr. Pamela.
Now, I know as the dermatologists of Nigeria, you have been, very active this World Skin Day / week. Can you tell us a bit about, what it is, why it is as dermatologists you're taking this on, and what it is you've been doing to make people aware about the World Skin Day?
Okay, so Ayesha. The World Skin Health Day, it's a global initiative and it's celebrated all over the world. And it actually came into play as to say dermatologists all over the world in their different societies. And this is because it became obvious that some individuals are underserved as to their skin care, whether medically or otherwise. So this initiative is to create awareness of skin, that the skin is an important organ in the human body, that it's a window into the human body, and then to create awareness and tell people how to look after their skin and how to seek help early enough.
And then another aspect, right, is also the fact that as a world body of dermatologists, we realize that everybody comes to us. And like Dr. Anaba had said, there is a large community that can't get access to dermatological care. So every year it changes. Each country can do something. You can go into the community, create awareness, offer services free. We've done that. We've done that over the past years. This year it's a bit of a different approach. So it's also reaching the undeserved people. So in Mexico, in Panama, in America, they do different things. We've reached out to the IDP camps here in Nigeria, and just different things in different parts of the world, but just letting people have access to dermatology care, apart from increasing awareness about common skin conditions and other things.
Okay, so Dr. Anaba, if you can start off with telling us then why, why is it so important? What's the skin? Why is it so important to maintain skin health?
First, the skin is the largest organ in the human body. We all see that the skin covers us from head to toe. It wraps every other organ you have. And so the skin allows us to see what is going on in the other organs that are covered by the skin. Like if you do not have, if somebody is dehydrated, not enough water, we can see it on the skin. The skin will look dull, it will look old. If you have like a liver disease, we can see it on the skin. You have a heart disease, we can see it on the skin. You have diabetes, we can see it on the skin. So typically the skin actually speaks. It tells somebody what is going on with you. And the specialist looking at you can, from a mile, say, this is what is going on with this person. This is why we all should take care. And then sometimes there are things happening to us that is actually a pointer to cancers. And we are seeing this on the skin, but people don't seem to recognize this or realize this. They just think my skin is just there. And then we see people applying all kinds of things to this same skin. And by the time you've done that, it leads to diseases in the kidneys or the heart or even the liver itself from what you have applied to the skin. This is why we are very interested in talking about the human skin.
Ayesha?
Okay, there are very many ways to also look at it. People, because of this shortage of dermatologists worldwide compared to the volume of human beings, and it's important for you to even look at the statistics that more than 3 billion people worldwide actually lack proper access to a dermatologist, and they will go without treatment. So they seek help elsewhere. And for us in our setting, they will seek help first from family and friends, from the church or the mosque, then from just around, and then they'll go to the chemist, then they'll go to the pharmacist, then they'll ask another medical personnel in the house or in the family, a nurse, a pharmacist, then the general physician or family physician. And by the time they're getting to the dermatologist, sometimes it's really, kind of like where you say end stage, you hear the story and they could have come earlier, but nonetheless, they've got to our doorstep. Many of these things are poorly treated, not recognized, and they use the wrong things. So these things also damage the skin, and it's knowingly and unknowingly. Some people don't know. So other things that we're also doing is increasing awareness amongst the healthcare workers. So we're also having a webinar for healthcare workers where we can teach them about common skin conditions. So that's another aspect. But the biggest problem is people not knowing what to do. I can give you, for example, in the last 2 weeks, today I saw one in clinic, but the one I saw last week was a young boy, had a rash. They felt his measles, the person in the chemist. They gave some medicines, and they give this one antibiotic, many things mixed together. Didn't get better. Then mother was told to go and get 7 keys. Child took 7 keys, came down with an adverse drug reaction. Eyes, like he had conjunctivitis, his skin was peeling. The poor boy was upset, crying, miserable. We heard the story 7 keys. Immediately, we told them this is what it is. We educated them. When he came back a week later, I have the picture before and after, smiling. He was so happy because his whole body was being shed. What do? They're going to treat measles, chickenpox, any rash, 7 keys. So they don't know that you can have a reaction to that herbal mixture of 7 keys. And they don't know, and it is commonly given. So we cannot overemphasize increasing the awareness amongst, the other healthcare workers who use this thing, but it is advertised for that. That is only just one thing. You also have triple action creams, and many of them use it. I've had a mother coming with her 2 teenage daughters. They had stretch marks on their thighs. And she said, "Doctor, why?"
Who's mute?
I don't know. We can't hear you, Aisha. You're going to continue. Just continue from, you said I had a mother who had a daughter with trial on her laps, and they asked you, and then you went off. So continue from there.
Okay. All right. My daughter is calling me. That's the annoying thing now. She keeps calling. Okay. All right.
Maybe she can call so that she won't bother. Let me just track
Send a message. Send a message. Can I call you later?
Yeah, I'm trying to type it, actually.
All right, I know where she'll start. She'll start from here.
I've had a mother coming with her 2 teenage daughters. They had stretch marks on their thighs. And she said, "Doctor, why?"
And that was when she left.
Yeah.
Oh, wow.
Okay. Let me come back to you.
Okay, so if you can start it again, Victor, just that short.
Okay. So from...
Dr. You want to talk about this?
I've had a mother coming with her 2 teenage daughters. They had stretch marks on their thighs. And she said, "Doctor, why?"
And that happened. Why? I don't know. So that was when you left.
Okay. All right. I'm going to go.
I think you should just pick it up from why you want to tell the story, which is I've had a mother coming with her teenage daughters, blah, blah, blah.
So I should start again. You'll come back.
Yeah.
You'll edit.
Yeah. Yes. Just start from where you want to talk about the story. I will pick it up from there.
Okay. All right.
Okay. So in 5, 4, 3, 2, 1, record.
It's recording. Please go on.
Oh, cool. Okay.
So I had a mother come into the clinic with her 2 teenage daughters, and her complaints was, "Doctor, I don't know why my children are getting stretch marks. They haven't had children. Me, that I'm a mother, I don't even have stretch marks like this. What do you think is causing it?" And then I looked at them, and obviously there were stretch marks, which were quite obvious, but on the thighs. So I then started to ask about the creams they were using, and we found out that she was using one organic cream that someone had recommended to her for her children. So then I asked her what it contained. She didn't know. So I let her know that the important thing about when you're using some of these organic products, which are sold all over the place illegally, contents are not listed, and they have potent steroids mixed into them, some of them. So that was giving the side effects of stretch marks. So I told her what to do: stop the cream, start to use some other things, and just actually cancel them on do's and don'ts and the right skincare products they can use. So this is just an example of, how people get to use the wrong things on their skin and have side effects.
I'd like you to take it a bit deeper, because that issue of steroids, you just mentioned one of the side effects. Can you talk about others? Because steroids are put into so many different things. People are not aware of why they shouldn't be using them. So can you just tell us about the long-term effects of steroids on the skin and how it affects the body?
Okay. Are you recording now?
It's been recording since. You can't stop. Like, we had to stop because of that whole incident. Now it causes a problem when you stop and start. It's because to record to the guy who's going to do the video is going to have a problem with this. Ebele, can you stop? Can you talk about others? Because steroids are put into.
There are many types of ways that the skin is affected by the use of steroids. Let's start from, first of all, it causes dyschromias. What I mean by that is patchy skin color. So you have people that will complain of dark patches here, light patches, and they'll say to you, doctor, my skin color is not even. You can also have fungal infections. So you have a propensity to develop more fungal infections because the skin's normal texture and architecture is in disarray. So you would have these fungal infections coming up, in different parts of the body. You can also have steroid-induced acne. So you're having acne on your chest and your back, and then acne that doesn't look like the typical acne that you find in people who are not using steroids. So we call it steroid-induced acne. There are several other things. You can have long-term use. You have these dark, very dark patches around this part of the face, the temple. It's called exogenous ochronosis. This is as a result of long-standing use of the hydroquinone type, containing lightening creams. Apart from that, you can have the striae, that's stretch marks that I've already mentioned. You can have buffalo hump, other systemic type of things start to come into play because of the long-term use of steroids, thinning of the skin on your abdomen. So if you go for an operation, you have stitches, the skin is friable. It easily tears. So if you have a stitch done, it can come apart. Your wounds don't heal easily, and you can have bruising as well. So these are the many things that people come into the clinic complaining of, and it's as a result of the inappropriate use of these potent steroids.
Thank you very much. So Dr. Anaba, do you want to add anything to what Dr. Ayesha has said?
Yes, please. Now, in addition to what Dr. Akinkugbe said about the steroids and their effects on the skin, steroids also affect your internal organs. Now, one of the ways that steroids work is that they actually open up more of your blood vessels. What that leads to is that the steroid itself now penetrates your skin into the internal organs. And now, those organs that are affected include the pancreas, so people now have more of diabetes. And very importantly, part of your ability to withstand stress is from an organ in the brain. And that organ helps you that when you are stressed, I'm not talking about when you're in Lagos traffic, I'm talking about, the human body, you have a fever, you have an illness, the ability of your body to withstand all of that. Now, rubbing those steroid things on your skin actually knocks off that ability of your body to do that. So any little thing that affects you, you have a kidney disease, you have whatever disease, it just makes it worse. So you have people now slowly finding it difficult to recover from whatever illnesses they have simply because of that steroid that they've been applying on their skin. Then you also have your upper body changing. you are gaining weight simply because of that steroid that you are rubbing. So you are gaining weight, especially on your upper body. You now look heavier on the upper body. And then also sometimes the kidneys themselves become collateral damage in all of this. Now, typically, a lot of people don't even realize that they are rubbing steroid because everybody's rubbing all these what we call triple action creams. So they tell you, oh, this cream can do everything. The cream has steroid, it has an antibacterial, it has an antifungal, and you're applying. Now, 2 days ago, I was in clinic, and a woman says that right from when her children were, she says, oh, we all rub Vaseline. I said, that's nice, very good. Say, hey, but we now mix a triple action cream. I said, what for? She said, oh, they were told that it's good for the skin. So she's been mixing triple action cream in her Vaseline and applying to her children because she, according to her, that they were told that that is a good thing to apply on the skin. This is what one of the reasons why we talk about the World Skin Health Day, just creating awareness so people can know that there are some things that are just harmful, including women who are applying these things on their newborn babies because they want the newborn babies to remain light complexion. Please, women, when a baby is born, the baby has not been exposed to sunshine. So the baby will look light complexion. The baby was in your tummy, no sun exposure. The baby will look light complexion. But the minute the baby comes out, the baby will begin to take their natural complexion. So that applying this steroid on a newborn baby's skin, just so that the baby can remain light complexion, you're actually killing that your baby slowly. One, you're destroying the skin, you're destroying the internal organs of the baby. And apart from now steroids that people use for lightening the skin, they use all kinds of things. And some of these things, hydroquinone, mercury, we are talking about kojic acid, butane, mulberry, licorice, all kinds of things. Apart from the effect on the skin, there's the kidney. So these things can lead to a damage of the kidney. There's also their effect on the liver. Yes, somebody may be willing to give you one kidney when your kidneys are no longer working. But guess what? To have that one kidney costs you a lot for the rest of your life. And that rest of your life is not even a very long one. So let us keep the one that we have and keep it healthy. The aim for everyone should be having a healthy skin, not a light complexion skin. So anything that has to do with once a cream is saying it makes you lighter, it makes you fair, it's maintaining your complexion, it's toning you, it makes you glow, it makes you pop, it makes you white. Stay away from those creams because not only are you doing something not right to your skin, you're also doing the same to your internal organs. You look at these people, they are standing in the sun, the whole skin is red, looking different color, they are sweating in different places, some even smelling, all in the name of having a light complexion skin. When you start, the skin looks nice, but down the road, that skin is going to look so ugly that even you, the owner of the skin, you won't like it. And at that point, nobody can really repair your skin. The skin is gone.
Thank you so much. I think, that emphasis. In Nigeria, we have such a high level of kidney failure. And for those who are not even aware of the cost of dialysis, the cost of even went to transplant, it is impossible. So many people are dying of this. And yet our markets are flooded with these creams. Ayesha?
Okay, just to follow on from the angle which Dr. Anaba was talking about. So they're sitting in front of me. I'm talking to them, like she has said, stop this, do this. Then they say, but doc, I want to have skin like you. Now look at your skin. And I say to them, well, I don't use lightening. First of all, my own genetic makeup gives me the fair complexion. But whatever shade of brown, I'm just very milky brown. So there are different shades of brown because nobody's actually black. It's just very dark. You know what I mean? So what we're trying to say is, how do you get it to look the same and look nice? And as they say, glow, because that's actually what they want, to glow or pop. You tell them it's the products you use. It's what you do. We live in the tropics. We stay in the sun. It's a given. Even on a rainy day, when the rain has finished, the sun will come out. Might not be as hot as before. So ideally, stay out of the sun as best as you can. Use sunscreen. Sunscreen is gaining traction. The sunscreen blocks you from the damage, the ultraviolet rays. So before even we move on to cancer, it will block you from photoaging, photo damage. There's phototoxicity. The sun is damaging to our skin. So you have fine wrinkles, you start to have a little bit of a tan. Your body is, as you age, it's going through aging process. And if you're using any of those bad products, that doesn't help. But on a good skin that is not even damaged, you still need to protect it. Just like they say, drink water, good balanced diet, same thing with the skin. Watch what you use. Sometimes we use products that actually strip our skin of the normal goodness. There's a lot of these antiseptic soaps that are stripping you from the normal oils that protect you. So there are lots of things that skincare practices are not. My take home would be use a bland soap, not too harsh. Know the products. If you need any help, seek the help. Ask for a dermatologist. There's a growing, we're growing, and there are dermatologists in almost every teaching hospital in Lagos and in the private hospitals, skincare regime. But most importantly, use sunscreen. Stay out of the sun. Use an umbrella. Patient today, young lady, talked to her. She said, "Oh, doctor," I said, "but you didn't put on your sunscreen this morning." She goes, "Oh, doctor, it's because the sun hadn't come up, but I have my umbrella with me." And I gave her a thumbs up, and I was like, "Wow, that's good." And she did. She had her umbrella. I said, "That's good. I like that." But then I now told her that because we're in the tropics, don't wait for the sun. Put it on. This was now about 11 o'clock. So I said, "Okay." We gave her some sunscreen. I said, "Okay, top it up and go out." There are light ones, there are colors, there are tinted ones that you can use. And that white cast that everybody used to say that, oh, the cosmeceutical products have changed now. So we have very nice, easy to apply. I put mine on top of my makeup when I have to go out again in the sun. So that would be my takeaway message. Let's try and protect the skin, make it look good, whatever shade of brown. You have to embrace your melanin. God blessed you with it.
Certainly.
That's my.
Dr. Anaba, any other tips on how to take care of your skin?
Yes. So now, first, your skin is who you are. And so it depends on what you eat, what you do with it, what you drink. So typically we want a healthy, glowing skin. So that starts with a well-hydrated skin. So if your skin is well-hydrated, it doesn't look old, it looks young. So you need to have at least 3 liters of fluid. That's 6 sachets of water, or 4 of the 750 mils of water. So that would be a combination of whether you're drinking tea, coffee, juice, whatever, 3 liters of fluid daily. Make sure you have vegetables and fruits in your diet. Those are your antioxidants. So with each day, as you move around, your body is detoxifying too many things. You make too many things in your body as a breakdown product. So those fruits and vegetables help to mop that up, because those things actually age the skin. Have enough sleep, because when you're sleeping, it tries to recover from the day activities. Smoking and alcohol, they age the skin. And like Dr. Akinkugbe just said, being in the sun also ages the skin. We may be the dark complexion brown people, but it doesn't mean that the sun is for us. So seek shade, use your umbrellas, use your sunscreen, wear long sleeve things, just things to protect you from the sun. Now, everybody's wondering, Black people sunscreen. That's because you haven't seen what the sun can do to human beings. 2 days ago, I had a young lady walking. Oh, she said, "I have one wound." It wasn't a wound. It was a large squamous cell carcinoma. And I showed her remaining body. I said, "Look at you because of what do you do for a living?" She sells recharge card. So she's outside in the sun. Because of, and no sunscreen, no sun protection. Because of that, she was full with lesions from sun exposure and a large squamous cell carcinoma. And all are popping and bleaching and all those people. That the melanin protects you from the sun. So when you're stripping the skin of melanin, that's where you're going, aging the skin and skin cancers. Now, the human skin comes with its own antibacterial and moisturizing properties. So when you start putting disinfectants in your bath water, using medicated soap, you're stripping the skin of so many things. And before you know it, the skin becomes itchy, it becomes dry, and then you have other problems with it. So we need to just stay with our normal toilet soap, stay away from the disinfectants and the medicated soap. And for goodness sake, we are not living in the gutter. We don't need to scrub the living daylights out of our skin. So we take the hard sponge, we are scrubbing and scrubbing away. No, you can even do without sponging. Your hand is good enough, but if you must sponge, take a soft cloth to sponge the skin.
Wow, that is so useful.
And if you have any disease, take the dermatologist.
Thank you. So we have no time left. So Ayesha, can you just give us some last words for our listeners?
Think deeply about what you do. Just think, when you're taking things in, applying things, it's not all the time that you should listen to what people have to say. I think some people just listen without even comprehending. So just be careful, look after your skin, look after your children's skin as well, because this damage to the children is the one that also bothers us a lot. Let them just embrace their skin naturally, whatever color it is.
Thank you very much.
Thank you for watching. Please like, share, and subscribe for new video updates.